So I'd be the first to say that the current situation, of course, is really, really tight. It's difficult, there are lots of challenges, and despite all those challenges though, I want to acknowledge the fantastic work that our staff do day in, day out, the progress that through their hard work we are making, and I can tell you it's making a difference, not just for the patients we serve, or for our reputation as an organisation, but actually externally to our organisation, people are beginning to see Cardiff and the Vale moving in the right direction. Well, we've brought together the senior teams from each of our clinical boards and a number of our corporate departments, and what we're really looking to do today is take organising for excellence from the position that it's in today and think forward from here in terms of how we can start to move what we're trying to deliver into a better place. And we've been looking backwards, so we've been reflecting on the progress that we've been making, and there are some very, very positive signs, but we're in no doubt there's still a lot more that we need to do. We've been trying to work out this afternoon exactly how we're going to take the next step in our journey. I think if we were thinking about the position we're in today and what's most important is I do think that we are at a point in our history where we have the opportunity actually to really push on now and take advantage of some of the things which I think are beginning to move in our favour. So, for example, we have focused very hard in the last few months on 5 big topics, and I can tell you that last week every single patient who had a stroke was straight into the acute stroke ward. We're on course to have fewer people waiting for treatment this year than there were last year. We've dramatically changed the way that cardiac surgery is experienced by patients. We've also had very significant improvements in our cancer services, and in fact by May, as things stand, we will be in a position where we will be the only health board in Wales achieving what needs to be done for cancer patients. So I'm really proud of what we've done in those services, and because of all of those achievements, we are getting the ear of those stakeholders around us, including the government, who we are going to need to work with us to ensure that what we need to do for the future is achievable. I was very pleased to hear that the presentation did spark off some questions, and they're really good questions in fact. How do we make choices about where we put our resources? How do we work more effectively with our health board partners around us? What's the role of this organisation with respect to regional services and other services? How should we fashion a relationship with the university, and how do we make sure that the skills training and the work that we have to do to have the workforce that we need for the future is all in hand? And those are really important questions. At the very bottom of all of this is an organisation that we would all like to belong to. And that organisation needs to go on a journey to get to the kind of organisation we want it to be for our population. We're describing that journey on a single piece of paper, and the idea is that that is something that people can read and understand, I hope. For me, the great place we could all start is just by thinking about the values, the things that are important that we all believe matter. And I'll use one of them to make this point. In our culture, in the future, we'd like people to believe this is a place where people are kind. They're kind to one another, they're kind to the patients we serve, we're kind to the families that are supporting the patients that we treat. And it costs nothing, and it makes the world of difference. And we can all choose to act with kindness today.